Welcome back. So what do you think? President Trump just decertified the Iran nuclear deal, leading the German foreign minister to say it will, quote, drive us Europeans into a common position with Russia and China against the USA. The president cut off subsidy payments to Obamacare, although, according to a new poll, 71% of Americans want to fix the Affordable Care Act, not kill it. And the president is threatening to pull federal resources out of hurricane-ravaged Puerto Rico, while according to another new poll, 62% of Americans don't believe the people there are getting the help that they need. Joining us for more is Jack Brill, vice chair of the Sarasota County Republican Party, Frank Alcock, a political science professor at New College, and Mark Weston, the author of The Runner-Up Presidency. Jack, it's been a dizzying 24 hours. Let's start with Obamacare. As we said, a new Kaiser Family Foundation poll finds that 71% of Americans want the Trump administration to fix the Affordable Care Act, which is pretty much the opposite of what he's trying to do.
But you got to remember, and he's done this a number of times, he's thrown it over to Congress. And if you think about following the Constitution, the executive order that President Obama put in is an appropriations, and only Congress is allowed to appropriate funds for programs. So if you look at, Congress can now, follow up, reappropriate the money, but you also have to look at that. The associations to be able to have state competition. You think about it, in 2016, there were 6.7 million people in this country, especially the younger and healthier, that paid the IRS tax versus actually taking Obamacare, because it was a lot cheaper.
So the answer is to kick it over to a Congress that has not been able to do anything about anything on anything. Frank, what happens now?
What happens now, unless there's something reversed in Congress, which is that's a bet that I don't see working out. What you're likely to see with these executive orders, you're likely to see a robust lemon plan come out, which is sort of low cost, very cheap health care plans, which will attract healthy younger Americans. It will pull them out of the insurance exchanges, the state exchanges, leaving a toxic risk pool that no insurance companies are going to want to touch. And then at the same time, pulling away the subsidies that incentivize that, without much of an answer with respect to, what mechanism are you going to provide to cover people with pre-existing health care that are not employed, they don't have insurer-backed employees. So you're likely to see healthy people buying lemon plans that don't provide much coverage, but they're cheap. And then the rest of the folks, I don't know what they're going to do about them.
Frank, but if you think about it, use that stat I use, you already got almost 7 million people last year that paid the $2,000 fine or whatever the current rate is, so they're already opted out, and they're still getting, so it's already happening.
I don't know if this is going to be that horrible for the younger Americans unless there's something that's not covered that they don't realize. But I do think people with pre-existing conditions, the older, the people that are in that 50 to 64 range, is yikes.
And we do have to cover pre-existing conditions.
Let me ask you this question. Between the Affordable Care Act action and also decertifying the Iran nuclear deal, you study presidents and presidential politics. Has anything like this happened before?
Not that I'm aware of. He has done more to undo the accomplishments of the Obama presidency in the last 48 hours than the rest of his term combined. So it's really quite huge.
Has any president taken this kind of executive action to undo a prior administration like this?
Usually when there is a social welfare program, the next administration will tweak it, modify it, but they won't just try to sabotage it. And same thing with treaties. Successive governments honor the agreements made by preceding governments.
Because that was the question that I have, and maybe we have to spill over to the next segment, but what precedence does this make if countries around the world will see the U.S. in terms of backing out of a deal? How good is an American deal in the future?
There's not going to be any agreement with North Korea. Why in the world would they have a nuclear agreement with us when the United States shows every sign of wanting to pull out of this one?
Okay, we are just getting warmed up. We'll have much more in the Week in Washington right after we check the First Alert weather. Stay with us. We're talking about the week in Washington, and joining us for more is Jack Brill, Vice Chair of the Sarasota County Republican Party, Frank Alcock, a political science professor at New College of Florida, and Mark Weston, author of The Runner-Up Presidency. And I know, gentlemen, you are all your harshest critics, as am I, as is our president. Let's take a look.
In the last 10 months, we have followed through on one promise after another. I didn't have a schedule, but if I did have a schedule, I would say we are substantially ahead of schedule.
I'm sorry, I must have missed the bill signing for the repeal and replace of Obamacare and tax reform. You know, he got a lot of cheers, friendly crowd today, Mark, but when you hear the president say something like that, you know, what are you thinking?
He has told so many falsehoods we can't even begin to count them. So this is just another one. There has not been one single major or even medium piece of legislation during this entire year. He's trying to undo Obamacare, and it's going to make it much more difficult to insure people with pre-existing conditions, which if the Republicans just had the honesty to say, we don't think the government is responsible for insuring people with pre-existing conditions, that would be one thing. But they don't say that. They say, oh, we can insure them, and it's going to be a great program, but they don't seem to realize that in order to have it paid for, you need young, healthy people contributing into the system.
But the legitimate question is, you know, where are the Democrats here? You know, I remember having David Jolly, the former Republican congressman, on this show, who leaned over and said, this is the perfect opportunity for Democrats to say, this is how we will fix Obamacare. And we're not hearing that yet.
Senators Lamar Alexander and Patty Murray are working on a bipartisan piece of legislation to improve Obamacare and fix the problems. And why more people aren't on board with this, I don't understand.
Jack, let me ask you this, because I know a lot of good Republicans on the Sun Coast agree with the president's agenda, but how do you feel about how he is trying to go about it?
As we have talked many times, he's unorthodox. We knew that when he was going in, and will continue to keep, you know, his strategy going the way he wants it to go. And part of that is to keep everybody, you know, keep moving along. Now, Mark, I do got to tie in. He's signed a ton of executive orders. You know, Obama signed a ton of executive orders.
And he criticized him for it.
And he did, and he's signing a lot of executive orders undoing the Obama executive orders.
You know,
so there has been a lot of that.
But you know, Frank, it's one thing to say that the president is unorthodox, but there are a lot of people who are watching this right now who are having a hard time making ends meet. They are, you know, they've had it with their health care insurance premiums and their out-of-pocket costs, and they're getting tired of you know, unorthodox leadership, and they want to see whether it's the Republicans or Democrats actually do something.
Yeah, it's the style and the results. I mean, the style, we're polarized on it. They're going to be the Trump haters and the Trump lovers. I don't know if that's ever going to change, but I think people are concerned first and foremost about results. I don't think the executive actions that this president has taken will make people's lives better. That certainly on domestic policy, and this week certainly on the international issues, which the stakes are extremely high when it comes to Iran, North Korea. The decertification is an initial step, but for me it comes back, unorthodox or not, it's not about niceties, and the Iranians are certainly tough players. You know, is this going to give us more or less leverage? And that's the question.
Jack, I'll give you a chance to respond, then I want to go to you.
But you got to remember, and it's something just because of the being involved in the healthcare business. So far this year, 86 hospitals in this country have filed for bankruptcy. We're on schedule because of the Medicaid reimbursements under the Affordable Health Care Act. There are going to be about 500 hospitals that close their doors around the country, most of them in smaller rural areas.
Isn't that happening because for the last several years, when it was obvious that Obamacare needed fixing, the Congress would not do so to shore up the markets?
I think it's a combination of, you know, the 17 was always going to be the big year of changes under the Affordable Health Care Act. That's when, you know, the temporary insurance, which a lot of businesses have gone to, went from a year to 90 days because, you know, it's a lot cheaper for a small business to do temporary insurance versus the plan. There's a number of dynamics that have gone in, and this was the year where it really kicked in, and our hospital system especially in the nonprofit community hospitals, are getting choked
Right,
by the
because
reimbursement.
Congress has not been willing to do anything about it.
But it's still under it's always under what started under the Affordable Health Care Act, though.
After Social Security was passed in the 1930s, people saw flaws, and Congress fixed them. Republicans who had voted against the Social Security Act recognized that the flaws needed to be fixed and helped everybody to fix them. That has not happened this time.
All right, let's turn to the Iran deal. What I don't get about, I mean, I get why the president said during the campaign that he did not like the Iran deal. I get that, but you have the Secretary of State, you have the Defense Secretary saying that that Iran was complying with the deal, and they were urging the president not to do what he did today. One professor from the Kennedy School of Government said today, Trump's erratic behavior at home and abroad has gravely damaged confidence in U.S. steadiness and leadership, and his policies are leaving other states, other countries, no choice but to explore other arrangements. That can't be good for U.S. foreign policy.
But if you look into it, he didn't get rid of the deal. He got out of him having to certify, being to certify that they're in compliance, which was one of his agenda items. It, again, as we discussed earlier, here's something that now Congress, it's over in Congress's lap to see whether they want to do sanctions, they want to keep the deal. So it's part of this, what is developing as the year has gone on, this strategy that he's thrown it over to
Frank,
Congress.
predict what's going to happen now.
Yeah, there's three things that I want people to focus on. Immediately, the first two, with respect to the Iranian deal, what the president did today, does this increase his ability to bring coercive pressure on the Iranians? If it does, then I'm like, well, we'll see how that works. I'm not sure if he can bring. It does release or potentially release the Iranians from their obligation. I do think, for all the flaws in this agreement, it did stall or slow down the Iranians' rush to a nuclear weapon. It might accelerate now. And then I think, with respect to every other country in the world, there is, why would you sign an agreement with the Americans? You could elect a Trump with 4 years, and they'll just turn around.
One more issue that I want to turn to, Puerto Rico.
Could I just want, this
Sure.
deal cannot be renegotiated. Fantasy scenarios where we get all these concessions and don't offer concessions in return is not going to happen. And we need this agreement as much as Iran does, because Trump said he would block all paths to an Iranian nuclear weapon, but he didn't say how he would do that short of war.
All right, so Jack, that is one of the issues here. Is it's one thing for the president to do what he did today, but you are not going to get the allies, England, France, China, Russia, in this situation to go along with the U.S. They are going to abide by those agreements, including the lifting of sanctions against Iran.
Probably, but we made Israel very happy today. So we have one ally that actually liked what we did. So
Check back and
check back. I'm not disagreeing with you. But Mark, to your point, of who's going to, it may have slowed down things, but at the same time, you've got to be able to, trust but verify. And how do we know they're going to end up doing it? They're doing it
The
anyway.
Defense Secretary did say that Iran has abided by the deal technically, that they have.
Are the most intrusive inspections of any nuclear agreement there's ever been. There are military sites we can't go to without notice, but you can't move or hide radioactivity. So that the inspectors can go to those military sites and measure things.
All right, we have to take a quick break, and we'll be right back with final thoughts in a moment. Time for final thoughts. I'm going to throw you all a curveball because, as I was mentioning in our commercial break, Public Policy Program polling did a poll of a dozen swing districts around the United States, and it shows that Republican incumbents in tight districts are falling behind. This is a very red district, but at what point, Jack, do you become concerned that things are not going quite well, the agenda is not getting through, and it may jeopardize Republicans in the midterms?
Well, number one, even as red as we are in Sarasota County and in the region, every race individually is a race you run 10 points behind because you want to make sure that your candidates win. And I think you also have to, all politics is local, as we all know. As long as in Sarasota County we're keeping our taxes low, we're keeping services, for our citizens that the Republicans and our elected officials, which are all Republican as we know, except for one, that's going to, there'll be a disconnect. I think you're seeing a lot more of a disconnect that it's, okay, those folks in Washington, if they're in D.C. for more than 10 minutes, they're now part of the establishment, but that won't affect us locally.
Jack, your take?
Frank.
Frank, I'm sorry.
Having run for the state senate, there's a degree of humility in terms of projecting beforehand, and I don't like to backtrack from calculations as to how this is going to affect or how do you posture in order to affect electoral outcomes. I'm concerned, like I said, for our nation's security. I'm concerned for middle and low-income families. How people end up voting in the next election, who knows?
Mark, we have less than a year left. A year in politics is a lifetime, so anything can happen. But what do you think?
I think this has already turned into a swing district that could go either way next November. The Republicans right now are still more afraid of having someone more conservative than they are run against them in the primary, so they haven't moved to the center. But each month that they don't move to the center, they jeopardize their seats.
All right, we'll have to leave it there. But before we go, we want to share with you some thoughts on last night's show, the cost of health care. The price of health care goes up year after year, not just Obamacare, but we're talking about employer-based insurance, the premiums, the copays, all increasing. Billy says when both parties do the will of the people, the issue of health care will be solved. We must cover those who need it, aid, and cut outrageous costs of premiums. Barbara says, I have been working in health care for over 30 years. What I have seen in that time is the insurance companies who are more focused on their investors than actually providing the services we pay premiums for have driven up the cost of health care. And Monica says the healthcare system is broken. Healthcare premiums have been skyrocketing for years long before Obamacare. The health care industry is a huge for-profit industry, and they work together paying off politicians by means of campaign contributions to protect those profits. Well, if you'd like to join the conversation about tonight's topic, just visit our Facebook page at facebook.com/mysuncoast.com.abc7. And FYI, you can watch past discussions. They're on demand. They're available on Apple TV, Amazon Fire, and Roku. And want to stay up to date on the latest local news? We're proud to announce our new ABC7 My Suncoast News app. If you're an iPhone or iPad user, currently have our news app, you'll want to go to the App Store now and download WWSB ABC7 Tampa My Suncoast. It's free, and it provides the most comprehensive news coverage for Sarasota, Manatee, Charlotte, Hardee, and DeSoto counties. Android users, no worries, you'll get the new version automatically. We want to thank our guests for being here tonight. Jack Brill is the vice chair of the Sarasota County Republican Party. Frank Alcock is a political science professor at New College, and Mark Weston is the author of The Runner-Up Presidency.